when you're standing over the tub, it's already working.
The Navy SEALs plunge in tubs,
Per
Warm tubs.
warm tubs.
I can't hear.
Warm tubs. Yeah, I mean, it was a negative reinforcement technique, so a lot of us had a lot of resistance to water for a long time. But, who am I to argue with science? So
Do you
I do
feel
think that there's value in just getting used to uncomfortable things. So maybe in that sense, here in the real world, it's kind of the one. It's a quick way to, I don't know, test yourself.
Did you ever spend so much time in water you would have like water aversions when you had to like shower if you had to grab something out of the sink?
Oh yeah, we'd go to the beach as a family, and I would just sit in the sand, like and just watch my kids play in the cold ocean,
Yeah.
the same ocean I hated. I'm like, I'm not getting in there.
I'm not getting in there. I know what's in there.
Yeah.
Dr. Kellum, welcome back.
Hey, thank you so much for having me.
You are our first returning guest.
Man, I feel privileged for that.
There you go.
We feel privileged.
You're gonna earn a jacket soon.
Yeah.
Pretty cool.
We'll get you like one of those SNL jackets, the purple velvet one. But you have to be on that.
What is that, velvet?
You have to be. Is it 5 times?
I don't know, but I know what you're talking about.
How many times do you have to host SNL? Somebody Google that. We don't have a computer guy behind the screen.
Janice in the back, could you look that up for us?
Producer Jamie.
And also the second best, at least top 2 shoe game
not gonna
of all
look it up.
guests.
Oh, I
Maybe
did-
top 1.
I didn't even see.
Yeah.
Can I see your shoes?
Put them up.
We got some
Oh.
J's on here.
Yeah, there we go.
Bro.
Back, a little retro.
Dang, Daniel.
Him and D-Rob could maybe, was he the guest that had all the
Yeah,
shoes?
D-Rob.
Yeah.
D-Rob is a sneakerhead.
Do you know off the top of your head how many shoes you have in your closet?
So I'm not really a sneakerhead.
Oh, okay.
And I can tell you, I think I have like 4 pair
Nice.
Of like total or just like
of J's.
flat? Oh, okay. They got so that's
And-
sneakerhead-ish.
And I only bought 1 pair. Three of them were given to me. So
Dang, you're a humble guy.
Yeah, that's cool.
yeah.
No one gives me anything.
That's completely false.
I mean, I don't know.
So I'm glad to have you back. I haven't seen you since last time you were here. I think I saw you from a long distance away at Target once,
Yes.
but I don't know.
I thought, did we not say hello? that
Maybe
day?
we did.
Yeah.
I've seen you multiple times at Target. Sometimes it's so far away, I'm not gonna like sprint across the candle aisle to be like, hey. And I think I was
Scream
checking
the
out.
whole way.
Yeah, yeah. Because when you're like out and about, you're a doctor. You see patients and have clients. Like sometimes when you're at the store, you don't want to talk to anybody, right?
Yeah.
But there's, yeah.
Fair enough.
I'm going to go get my cucumbers and I'm going to head out.
I would stand by. I don't think there's a worse feeling in your stomach than when you're just like at your cucumber aisle and you hear your name like yelled and you're like,
Yeah.
True.
Yeah.
True.
Thought about that too. Yeah. You're just like,
Why are we in the cucumber aisle?
Something-
Y'all know Animal House, that movie? No?
Uh-uh.
And there's a famous cucumber aisle supermarket scene. Google that.
So now that you're back, I know a lot of people have reached out to me.
Wait, hold on just
Yeah,
a second.
yeah,
Can
yeah,
I
yeah.
say this?
Oh, of course.
Yeah.
Say whatever you want. That's why you're here.
So the last time I was in, like you guys, like I don't know what's happening. You guys are in more shape than you were the last time. Like what's going on around there?
Fresh pump.
Oh yeah, today's workout was a fresh pumps. You know what that is?
No, but it's whatever it is, it's working.
We're inflated.
You
right?
guys look good.
We're very inflated. The workout today was like 97.5% upper body. And it really has been that for like the last week.
last
Probably.
5
We
years.
haven't used our legs this week.
Hypertrophy was
You
the
guys have
theme.
a serious pump going on.
Yeah, so we're just like, would you say we're swollen? Is that what you said?
Yeah, we'll fresh pump on.
Yeah.
Yeah, it just happened.
But I mean, that's kind of the goal. Hopefully every time you come on, we'll look a little fitter than we did the last time you were on.
Looking great. You guys are doing something well around here for sure.
Well, on that note, I want you to just really, really quickly, because I'm trying to mind our listeners. We all know what you do. I respect what you do, but just give us a quick catch up. What's happened with you
Yeah.
and your business? And because we get a lot of people on our podcast that are like trainers, they're wannabe trainers, they're managers here, but like you're a legitimate guy. You're a doctor. You practice. You're very smart. You're healthy. There's probably a little more credibility to what you do than like some of the, I don't know, fitness bozos we get to talk to, you know?
Well, I appreciate that. I don't know about that, but appreciate that. And and yeah, so so I'm an orthopedic surgeon by training. You guys know that. And probably about 7 years ago, I started to do mostly regenerative medicine in the form of stem cells and growth factors. And so we've continued that. We still do that. We still operate some. We try to keep people out of the operating room, obviously. But we have expanded now to start to treat more chronic diseases. So we like to say, from arthritis to autism, we can help you. And so your body, your stem cells, your solution. So we rebranded here recently, and we're now Kellum Stem Cell Institute versus Nashville Regenerative Orthopedics. Although we still, our first love is still orthopedics, but now we handle, folks that have Parkinson's or MS or, just chronic diseases, heart problems, lung problems, as well as all the musculoskeletal things that we do.
So I would imagine there's a couple of things that happened along your career of being an orthopedic surgeon that kind of like folded you over into this process of, like you said, you
Yeah.
rebranded, and now you're at a point where it's like, I can do more and I want to do more.
Yeah.
And it's more important to do more than just operate on people and send them next door to the physical therapy clinic. Can you maybe name 1, 2, 3 things
Yeah.
that were a catalyst for your decision to rebrand from Nashville Regenerative Orthopedics to Kellum Stem Cells?
Yeah, so one of the big things was just that there's a need for it. As you think about all these chronic diseases that just like within orthopedics, there's no great middle ground,
Yeah.
and so stem cells would really bridge that gap. And so even for chronic diseases, there's no middle ground. It's like, well, either you can go over here and you can suffer and just until you die, or maybe we can give you these harsh medications and well, that's going to help you die too. To now we have, something that can actually kind of slow the progression of what's going on with the person. So that was the big thing.
What's one of the most prominent, like you said, I'll use the term chronic diseases that you're treating at the moment, and what are you doing to treat it that's maybe not as mainstream as a normal doctor?
Yeah, so you would take something like Lou Gehrig's disease, right? So ALS. So using stem cells intravenously to treat that disease and try to slow the progression of those things. All of these things that we treat are about inflammation. And when inflammation is high, it wrecks everything, our immune system, everything. And so when we can dial that back, then things are better. Or even sometimes when our immune system isn't working the way it's supposed to, stem cells helps bring that up. So yeah, something like Lou Gehrig's muscular dystrophy, multiple sclerosis, MS, a whole host of things we can treat now with this.
Is there one particular disease that you've seen like the highest rate of success as far as maybe completely diminishing the disease or slowing down at a higher rate than you've seen? Like let's say ALS or I know you mentioned autism. Is there one of the two or along the scale that are probably the most treatable with stem cells specifically?
All of them are very treatable. It just depends on where they are in the disease process. Obviously, the earlier we get to them, the better it is for them. And so it just kind of depends. Every case is a little different, but the earlier we get to those guys, the better it is for them.
So educate us a little bit, because I guess now the last time we talked to you, and in my mind, the whole stem cell therapy thing is like, let's say Matt tore his labrum right here, and he doesn't want to be operated on. I'm going to send him to you. Let's get him some injections, send him on his way. He heals. He's got an 18-year-old labrum that grew back in his shoulder, so to speak. But it sounds like it's maybe bigger than that, or stem cells can kind of do more than just heal tendons. And
Yeah, so stem cells primarily work in 2 ways. Number one, they're going to decrease the inflammation, right? So when inflammation is gone, then therefore pain is normally gone, and then functions better. And then when you look at, and then the other way is they can become the tissues that we're treating. They can, and the cells and those things, and they can make the tissue that's there bigger, stronger, better, faster.
And then we're talking about stem cells that you're harvesting from the patients themselves, right?
Correct,
And you
yeah.
typically use adipose for that?
So we use adipose and bone marrow. So adipose, which is fat tissue, and then bone marrow. So I like to call myself an equal opportunist. I use both of them. I don't kind of discriminate. They both have things that you like, and so I just like put it all in there. and give it-
is one more cost effective than the other? The biggest thing I hear when I will recommend, hey, maybe go talk to a doctor about stem cell. Does insurance cover it? And I know it's more of like a higher cost thing,
Right.
but higher reward.
Exactly.
Is there one that's different you prefer, you would recommend?
So definitely taking material from you, right? That's going to be more cost effective. Now initially it may seem like it costs more, but over the long run, it's going to cost you less. And then And then if you're looking at the two places that we harvest from, as far as from bone marrow or from the fat tissue, adipose just you almost can grow adipose for forever. So that one is definitely most cost effective at the end of the day.
And by Grow Forever, are you talking about that banking process that you've
Banking,
started?
yeah. So we have a lab where
Could you explain to everyone about banking?
yeah. So banking is where once we take your stem cells, we take the fat, the stem cells are in there. We get rid of the fat tissue, just have the stem cells, and we send it to our lab. Our lab then will take it and save it. So now, as time goes, we can say, "Gosh, I want to have 100 million cells or 500 million cells," and we go, "All right," and we grow out 500 million cells, and then we put that in various places, whether intravenously for you, intranasally, or put it back locally, like in a joint or tissue.
And is that something like could athletes who are healthy or children when they're young like harvest them and then you just have them like for that rainy day, like oh they tore their ACL when they were 16, or oh they're a pro who something happened and you
You
just
got
have
the
them?
money for it.
Yeah, so we have a essentially a program set up for our professional athletes. We call it's a kind of a bio insurance, but we take their cells, we bank them, and let's say on a Sunday they get a concussion. By Tuesday, we've got some stem cells for them to help them with that. And obviously, the younger you are when you do it, the younger your cells are. And I know a lot of families these days are doing things like Vitacord or stuff like that. And I really caution people against that, because if you're going to use a Vitacord like in real life, then
What's a Vitacord?
so it's a where you can take the umbilical cord from your child or whatever, take
Boy.
the cells out of that, bank them. The hard part about a company like that is that you have to be a part of a research and like a study to actually get those, versus with the way we do it is that it's your cells, and anytime you want them, you can have them. They're not going to go to anyone else. If you die, they're destroyed. Things of that nature.
I want to go back to the ALS part.
Yeah.
Okay, so it's not the typical chronic disease I think of, but
Yeah.
I guess your body just stops functioning, right? Your muscles stop working. Eventually,
Nerves.
you're gonna die, right? So, what is when you put those stem cells in? What happens? It's just is it a quality of life issue for the person who's suffering and dying?
Yeah.
Because you're not gonna, right? They're gonna die.
Yeah,
So,
eventually.
what do they do in the stem cells?
So quality of life, it's going to be, hey, we're gonna slow the progression of that disease down, so
So they can buy a little more time.
buy a little more time, and hopefully that the little more time that they buy is better time.
It's quality time, right?
Yeah,
Less
so
painful too, right?
less painful, decreasing that inflammation, so you're gonna feel better, you're gonna do better.
Does ALS hurt, or is it just you just stop working?
I don't.
I'm not clear on it. I know.
Yeah,
I'll-
I would imagine
Never
there's
asked that question.
some pain associated with those things, but I think most of the pain is going to come from like, hey, I'm in here, but I just can't. Do what
Right,
I
you're
wanna do.
here.
Yeah,
But this doesn't work. Right. And you mentioned chronic disease. I think more heart disease,
Heart disease is a big
diabetes.
one.
Okay,
Diabetes.
so fitness-ish podcast. Like talk about diabetes. What is it? What is it going to do for your diabetes? Because we know that, right? Fitness and diet is going to help that. What is the stem cell going to do
So even if you're
on top of that?
even when you consider like a type 1 diabetes versus a type 2, so type 1 says, hey, you don't have enough insulin, right?
Right.
Type 2 says you got plenty, but you're resistant to it. So with the type 1, hey, we're going to help those pancreas cells who make the insulin. We're going to help them do what they're supposed to do. And so hopefully we can lessen the amount of insulin that you need. And we'll come back to that in a second about what
Okay.
insulin does to you when you take it. Versus a type 2 that says, okay, the cell says, well, I'm kind of like, I know the insulin is around, but I don't want to respond to it. Well, now I'm going to do what I'm supposed to because the stem cell has given me the message like, hey, buddy, you need to wake up, do what you're supposed to do. And now that cell is now sensitive to that insulin, so it works the way it's supposed to. So stem cells are they're great because they regulate everything and make it do what it's supposed to do.
Gotcha.
So what would be, actually I have 3 clients off top who are type 1 diabetics. What would be like a practical change they would see from doing stem cells? Or what would be like what would you do for them? Type 1 diabetics interested in stem cells to kind of help do some things. They're already very active, eating healthy. Like what would they do with stem cells and what could they expect to see different?
Yeah, so doing stem cells, so harvesting that from them, then growing that, or even treating them that same day. But the things to expect would be like, hey, I don't need as much insulin. Hey, the symptoms that I have from that are better. My hemoglobin A1C has dropped. Those things are what we're looking at. So definitely some of those markers can be seen.
And I mean, my brain doesn't really understand what happens with stem cells. Is it something kind of like you get the sauce and then eventually, like over time, it goes away, or what? Like, does it change how your body responds indefinitely, or what do they?
Not indefinitely. So it's one of those things that it's going to give you so long, right? And then you're going to lose the effect of that. So then you want to treat again. So I always tell people, it doesn't work forever from one injection, but especially for chronic diseases, like, hey, we treat you now. Maybe it's, for instance, we'll take a chronic disease like rheumatoid arthritis, right? So they can have the skin issues, the pain. Let's say we treat them with stem cells, and they may feel really good for 4 years.
Oh, wow,
Like
that
they
long.
don't have the joint pain that they normally had. They don't have the skin issues that they normally had, and so that's what stem cells. And so then it kind of starts to creep back, and then we treat them again.
So is that, I know 4 years is probably a little bit of not like a totally guaranteed thing, right? It could be 6, could be 8, it could be 2 years.
Exactly.
Is there any type of injury or ailment that you've seen stem cell kind of like a one and done sort of thing?
The things that we like soft tissue issues that someone will have fairly acutely, those things you can treat and they may like not ever have that again, right? Depends on what they do. Depends on how much they come and see you guys.
Like a torn ligament, you can treat that as well.
You can treat, yeah.
And that just helps it heal faster.
Right. Helps it heal faster, helps it heal, number one, helps it heal faster, and they may not ever have another issue with that, right?
So I've told quite a few people that I know that are kind of like on that death's row of surgeries up and coming, and I've tried to maybe steer them away from them and tell them about you and your practice and what you guys do. And a big response that I get is like, oh, I thought you had to go to Mexico to some sketchy, crack house that also has a somewhat certified doctor there to get stem cells, and when I tell them like, no, there's a doctor here that we know who's got a killer reputation. You've treated a couple of my clients here in Franklin, and it's like mind blowing to them. Sketchy Franklin. Cool Springs is a dangerous place. Why is it that there's still like this weird ideology that you got to go to Mexico and that you can't go somewhere like Sketchy Franklin to get it done? Are you the only guy around here who does this?
I would say the only one, especially the way we do it. Yeah.
Okay.
Around here, that just has to do with the word getting out, right?
Yeah.
People just don't know, and people know enough about stem cells. They've talked enough about it, and everybody knows somebody that it's like been to Mexico or something like that. And so it's kind of one of those word of mouth kind of things, and it just hadn't gotten out quite yet. And for a long time, it was the being here in the States made it hard to do it the way we do it now. And then there was a lawsuit filed against the FDA, which was by a clinic, which was they won, and so it kind of opened things up for us. So that's why we're able to bank stem cells, we're able to culture those things, and so we've been looking with great anticipation when that day would kind of come. So here we are.
Do you remember your first, we'll call it like success story with stem cells in a patient of yours?
Yeah.
And if so, what was it? Who was it? And what was your sort of emotional approach before, during, and after the result? When you kind of heard what happened.
I'll talk about a stem cell patient because my very first patient with just regenerative was a PRP patient and a runner. That was years ago, and I was like amazed that it worked. But my first would have been like, other than like fellowship, like when I'm on my own.
Yeah.
Get here to Franklin, 6, almost 7 years ago, and treated someone's knee. They had arthritis, and I would always have patients come back at 3 months, and they're like, "Hey, I'm better, and I can do this and this," and I'm like, really? Are you lying to me? Or is this true? And still, even today, after all these years.
And that's the first time you treated somebody with it?
First time, yeah. And still, even after all these years, it still amazes me. Like, folks come in, I mean, I've seen thousands of people, and you're just like, you're better? It just keeps going.
Yeah, that's always intriguing to me, because I think a lot of people have this impression that like doctors are separate, right? Like you're separate, like you don't have that feeling of, oh, this is the first time I'm administering this treatment. Is it gonna work?
Yeah.
Right. I think like you guys maybe on a different level than fitness trainers, like we kind of figure things out as we go sometimes as well, not without doing some background and research and practice first.
Yeah.
But there's always that element of, I don't know, it could
Yeah.
work. I could put somebody through this 8-week strength cycle and I'm sweating when they're going to retest whether or not they're going to get better.
Exactly.
So it's nice to know that you had that. Was it fear maybe?
Well, it's just yeah, it's like hey, I don't know. Like this person's trusting me. I want to do well for them.
Yeah.
But I don't know. It's like but you know, back to what you're saying, you wonder about the person like, well, whoever decided to put leeches on a patient?
Yeah.
Like who did that for the first time? And what did they think about that? Did you really think that was a good idea? You know, it's things like that. And that definitely crosses your mind. But once again, all the research, you put time, all the things that you've already learned, you're saying, okay, I'm going to put all this together and I think this is going to get me to a good place.
Now, after years of doing it, does that feeling dissipate, or are you still kind of nervous every time you get that 3-month return visit?
So I'm not as nervous now, but I still get that in awe about what just happened.
Yeah.
Like I still think, gosh, you're really better? Like it's kind of and definitely as we have progressed into different things, and we do more of the more of the chronic diseases, that's been really, that's kind of renewed that awness about it.
Is there a percentage work, not work? Like you could take 10 people who all have arthritis, you give them all the same treatment. Does it work for all of them? Or do some people just not react at all and you say, well, this isn't the treatment for you?
Yeah. So there's
non-successes.
yeah. So there's definitely, so like take somebody with knee arthritis. I know that and this is research that I have on my own patients, 9 out of 10 people that walk into my office, they're going to get better. There's going to be 10% that doesn't. If we're looking at like a shoulder or something like that, I know that probably about 20% aren't going to respond. And I always tell people this when they come in. I'm very upfront with them and say, hey, I think this can help you. Here's your percentages.
Okay.
So yeah, there's definitely measurable.
And the more you do, the more you learn from that. Right.
100%.
Have you ever gotten emotional after treating somebody and seeing or hearing the results and how it affected their lives going forward?
Yes, there's times when people, they want to play with their grandkids or they want to do Spartan races or things of that nature, or they were having so much pain that they're not, having now, and the story that surrounded that. I mean, yeah, definitely.
Is there one like really specific, maybe semi-recent instance where you might have had to like hold back a little bit of emotion sitting one-on-one with one of your patients,
Yeah,
hearing the results?
Yeah, so a guy that he wanted to get back to running a Spartan race is what he wanted to do, and so he was older in his 50s, and just couldn't do that, couldn't train. It was super hard for him. Wanted to do those things with his children, so him getting back to doing that was was a lot for me, and so definitely very very emotional and very happy for him.
And what do you remember what he said to you that maybe alluded to the fact like, hey, you've improved the quality of my life through this treatment?
Yeah, no, it's just just super thankful.
Yeah.
Thanks for helping me get this back.
I imagine Parkinson's and ALS, you get a few of those and you're going to see where they're saying, this 3 years, like you gave them 3 years more,
Yeah.
right, with their families and all that stuff. Those will probably hit home too.
Oh, for sure.
What's the average? Let's say, I don't know, a knee injury, meniscus. You get stem cell treatment versus getting surgery. Time of recovery of stem cell patient versus a surgical procedure.
Yeah.
And then what's the aftercare look like? Because 9 times out of 10, someone hurts their knee and they're getting cut open, and then they go to PT and they walk sideways with the band, and then they're not allowed to go to the gym and squat below parallel.
Yeah.
What's
so
the difference?
This is one of the things I love to talk about because meniscus surgery is one of those that, unless it's like causing it to get stuck, the knee really should almost never be done, especially in someone that's probably
Say that one more time.
so someone that has a meniscal tear.
Yeah.
And unless they're like younger than 35 and it's causing the knee to get stuck, really shouldn't have meniscal surgery. So when you go in there and you take that meniscus out, you now have less meniscus. And because of that, now the stresses across that knee are different. And when that happens, now you develop arthritis quicker and pain quicker. And there's plenty of research studies. Like I'm not just like telling you, like saying this. To
Yeah.
you, like plenty of research studies that go, this is a bad idea. But yeah, it's a surgery that we continue to do over and over again.
I feel like last time, maybe I'm getting confused, but last time you were here, you said that it's pretty much guaranteed a knee replacement
Yeah.
in like 20 years, or you had like a time limit.
Oh yeah.
Yeah,
I remember
probably
that.
probably less than that. Like if in the right person, let's say 50 and above, you take out that meniscus, they may initially feel better, but then they're 2 years and like, oh, this hurts worse than it did before, and they're like, oh, time for your total knee.
And then after like a stem cell treatment for, we'll just stay on the topic of knees. What happens afterwards? So like, let's say I come to you,
Yeah.
you inject the stem cells to my knee, and how soon am I back in the gym? How soon am I back running? Do I need to go see a physical therapist? If I do, are they going to actually help me? What's that kind of process look like?
Yeah. So knee. So we inject you. I tell you to rest it for 2 weeks, meaning that you can do daily activity. I don't want you to like work out with that. And this is a perfect world.
Yeah.
And we'll kind of talk about what's not a perfect world. So 2 weeks of rest and then 6 weeks of physical therapy that you can go to the therapist, but it should be super gentle, like nothing crazy. They shouldn't be, cranking on you, hurting you, those sorts of things. Super gentle, just range of motion. And I tell people that limb, that leg, I don't want you to work out with, but you can work out everything else, right? And just do therapy directed things at that point in time. And then so at 8 weeks, we say, okay, we'll turn you loose, and we just want you to kind of continue. We want you to increase whatever it is that you like to do, as long as it doesn't hurt you more than a 2 out of 10 on the pain scale. Then we let you keep progressing up. Now with any professional player, they could be out there in 2 weeks or 1 week or
Yeah.
things like that. Blah blah blah.
Because they're just going to push through it
Yeah,
for
it's
the
a little-
sake
it's a little
of
bit
that's how their
different.
brains work, and also the paychecks.
But in a perfect world, I get about 8 weeks where you rest it. And do physical therapy things for it.
But you're not like in a full-on leg brace, hobbling around.
You're not
parking lot trying to
immobile.
run.
Yeah. Very rarely put you in any sort of brace or anything like that.
What other kinds of treatments? I know you said with the rebrand, you're looking at like alternative medicine, or I don't know if you said alternative medicine, but my brain went there.
Yeah.
Outside of the stem cells, and I know you're kind of weaning out of surgery. What other types of treatments have you become interested in? Have you tried yourself?
Yeah.
Are you maybe experimenting with? Are there anything that's maybe to the outside world seen as less medical?
So ozone's a big one.
Educate us on that.
So oxygen is O2. Ozone, you're going to add another oxygen to that. So now you have 3 oxygens. And you can give ozone locally, and it's in the form of a gas, or you can give it intravenously. And at the end of the day, these things, they kind of all do the same things in different ways, but ozone is going to help to decrease inflammation, and also it's going to help the cell do what it's supposed to do. At the end of the day, if a cell, as we get older, our cells just get tired. Then it becomes less efficient. So ozone is going to help those cells become more efficient.
How do you inject it if it's a gas?
Yeah, so a gas, you take a needle,
Yeah.
and let's say you're going to do it locally, like in a knee, and numb everything up that you can numb up. But then you're going to just put it into the knee joint, or
Into the joint. Okay,
yeah.
not into the. Okay, I was thinking into a vein. I was like, how do you
Oh
put
no,
gas
but
into a vein?
Well,
'Cause that sounds
Let me back up.
dangerous.
So you do put it into a vein, but not directly. So you take blood out. That's going to be the carrier. You put the blood in with saline in a bag, and then you inject ozone in the bag, and then you put
Shake it up, let all the fizzy happen.
yeah,
And then
like
put
a-
it back in.
Have you been bartending lately?
No, but I feel like it's like flat soda. You're just gonna put it in there.
He was on
After you put
Broadway
the
this
CO2
week, so he's feeling
How'd you
himself.
put CO2 in there?
Yeah, no, exactly.
Okay.
100%. So you wouldn't put it. You wouldn't.
Yeah, just you said intravenous, and I
You're
just was like,
whoa,
oh, okay,
Whoa,
You're gonna
I'm
die.
gonna have to help him.
yeah.
But yeah, so ozone's a big one.
All right.
PEMF is one, like in the last, I don't know, couple of months that have been super.
And that stands for
Pulsed electromagnetic field. So giving energy.
Bruh, explain that.
Yeah. So we're like, it's very interesting, and I get kind of deep when I think about this. But we are a ball of energy. Like we're all the atoms have come together and we see this physicalness, but we're really just like it's like we separate, right? It's just kind of weird to think about. But so our cells don't work very well; they become inefficient. But when you can apart energy to them, right, then they do what they're supposed to do. And so when you give pulse electromagnetic field to folks, and the right kind, you don't want to live on
You
like
just
a
stand
power
in front of like a speaker throwing vibrations at me. Is that how explain that?
Well, are you lay on a mat?
Or is this like grounding outside?
Well, it's kind of like grounding, right? The whole magnetism deal.
Yeah, I
It's
thought you were
very
grounding.
much like that.
Okay.
But we're just going to give it to you, right? You don't have to like put your feet on the earth.
Put your toes in the.
But is it like a room? Is there a sound?
So yeah, you sit in a room. There's a mat. It imparts to the mat, and then you lie on it, and then you absorb it.
And is that like a wellness? Is it a healing, or what's going to happen when I leave the room?
What's that?
Or like what happens? So I do it. Am
Yeah.
I more well? Does it heal an injury or what?
Heals an injury, makes cells do what they're supposed to do.
You hit a nerve here with this.
Yeah. So
Field.
it's going to essentially going to cause a cell to make ATP. When ATP is around, that's the powerhouse.
We like that. We
The-
like
the-
ATP.
Yeah.
Love extra ATP.
Yeah.
Yeah.
And so
Give me
Adenosine
ATP.
triphosphate. What's up?
Exactly. Exactly. So now the body does what it's supposed to do, right? So if it's supposed to get rid of toxins, we're gonna get rid of those things. If it's supposed to, we're supposed to contract over here because we're
How long is that? How long are you treated? Like in a session?
not long, like
Like 20 minutes?
10, 20 would be a long time. 10
Okay.
minutes. Yeah, it's not long at all.
Do rich
Have
people
you
have
done
those
it
at home?
personally?
Some people do. I have done one session of PMF probably about 4 years ago, and there, things come to me like it comes to everybody. Like there's some things I'm super skeptical of. I'm like, I don't know. I don't think that has any. And then you start reading, you start looking at it, and you go, oh, wish I would have paid attention then.
Sounds a lot easier than making ice, Kim, for the tub.
An entire
Just plug your
machine.
mat in and just lay down. I mean, that sounds like my jam right there.
Yeah.
Don't hit on my tub.
You guys should really look into it. It's for anti-aging, for wellness, when you actually have injury, when you actually have diseases. I mean, pets, if they're using it in the pet world or in the horse world, it's a real deal.
Horses, yeah.
There's money.
I'm skeptical on
Yeah.
pets, but I think horses are
Yeah,
awesome.
if they're using it in the horse world, it's a real deal. So PMF is huge in the horse world.
Now, when you say the horse world, like
Equine,
racing
race
horses,
horses.
yeah,
And of course, every horse that you see at the Belmont Stakes,
they're on steroids.
Yeah.
they're doing drugs. 100%.
Right.
They're all of them have PRP, right? All of them
Just like the CrossFit Games.
that's your world. I don't know about that.
They all pass the drug test though. The horses somehow.
Yeah.
Yeah.
So do the CrossFit Games athletes.
But yeah,
Hey, wait, really quick. I want to do. What's the usage of steroids in the Navy, particularly SEAL? Or you can't even comment on that, can you?
I don't want to
know.
die today. I don't want to die.
I know.
He has a big weekend ahead of him. He probably doesn't want to ruin it.
Or are you allowed? Like, did you have fellow operators that were juicing?
The
Can you say that?
policy is no.
Yeah.
The policy is absolutely no substances. There are guys who are performing well physically at their job for their age. And in fairness to that, the requirements, right? We're not sleeping, we're not
Right.
consistent dietary.
Are you tested? Do they have like?
If you're in trouble.
I think it's if you're in trouble. I've
I got
seen
you.
guys who maybe were on a
You're
track.
somebody.
Have you ever been drug tested?
Look at me. Do I look like
Yes,
I'm
I've been drug tested. True story. One
Yeah,
time.
really?
well,
Yeah.
I don't know if this will offend you, but I think if you're a SEAL, I want you to have access to every
Yeah.
drug and all the education on it and
Yeah.
every doctor. And then, I mean, I'm not saying you have to take it, but if you want to, I want you to be able to learn all about
Yeah.
it, and I want you to juice.
I think you all should be sleeping on mats
defend-
made out of those vibrations.
Well, if not, if,
Well,
if
if
the
you say that,
bunks.
I've heard about these, and I could be wrong, but I want to say that with the horses, I heard about this, it was like a carbon fiber plate. And they would kind of wrap it around a limb, and they would, I don't know, electrify it or something. And this guy that was telling me about it his family's big into expensive horses, and he swore by it.
So your new place has rooms of all these things in it?
We have ozone. We don't have PEMF yet,
Oh, okay.
but it's coming.
When you get that, we're gonna come try that out.
Come on by.
you're paying
It's
for
a
it.
big deal.
I mean, I have a Groupon
Yeah,
for
I'm
free for you guys. Free for
Oh
you guys.
man, that's too. No, we don't like free stuff.
I just told you no one gives me anything.
Okay, well now you can't say that. Now you can't say that. All right, so we got the energy electric stuff.
Okay.
I know that's very technical of me to say. What other alternative treatments have you either tried or have thought about implementing at Kellum Stem Cell Institute?
Let's see. What are we? We're kind of boring, after those things as far as what we implement. Like we obviously love for hormones to be balanced.
Oh, I have a
nutrition
question
is
about
huge.
the hormone stuff.
There we go.
Particularly, this is more of my brain as a business owner wanting
Yeah.
to know. Now, Kellum Stem Cell Institute is for the most part, it's you. You're kind of a one man show. I know you have staff and they do a lot for you and stuff, so I don't want to discredit them, but it's you. Without sounding too invasive, I know you had a business partner not terribly long ago.
Yeah.
In this hormone world.
Yes.
Are you at liberty to speak about how that came about, what exactly it was, and then how it maybe sort of left your grasp?
Yeah. So yeah, definitely was a part of that. Got out of that just because you have differences and all that good stuff, and that's fine. I still do those things.
Yeah.
I still believe in that. So it's still going. That was that was all knowledge that I brought to the table. They brought other things to the table, which were great. And it came about once again because of a need. Looking, peptides, which I think are great.
Yeah,
things.
I guess to be less encryptive, I was talking specifically about as edge peptide therapy that you basically put on your back and said, let's offer this to the masses.
Yeah,
Make
and
frank.
and I didn't do it by myself. There were two other partners,
Yeah.
and for me, I needed to concentrate on what I was doing there,
Yeah,
and so it made sense for me to kind of move out of that. Once again, I still treat patients with those things as it relates to the regenerative world.
yeah. So almost like as need basis, like if you see that they
Especially-
could
especially-
benefit from it, you implement it.
Chronic diseases and stuff you're talking about. If you have pain, there's a lot of those peptides that can help you pain wise and
Yeah,
right recovering of
BBC
muscle.
157 is really good.
Yeah,
Yeah, it just kind of seemed to me that the word peptide kind of has a weird buzz around it in our world, in the fitness world.
Yes.
As like a not a designer steroid, but like a cheap, sort of easy to get internet steroid
yeah.
performance.
It probably gets mixed in with SARMs when we think of the same person.
Yeah.
Right?
Yeah.
When
Yeah.
it's probably
Versus somebody with like muscular dystrophy who could really benefit from some kind of muscle building
Yeah.
agent peptide.
Yep.
So I guess is there a big difference? What's the in your mind the relationship between like something like a SARM and a peptide?
So as I think about a SARM and a peptide, and it just depends on how you are relating that to the person who's taking it, right?
Yeah.
My opinion, which is kind of funny, if you were to ask me as a physician about anabolic steroids and those things, like hey Ethan, what are your thoughts on that? And I would go, I think everybody ought to take them within reason, right? Because if you can be stronger, and we know if you're stronger, you have more muscle, that you do better as you age.
Yeah.
Right. We know that 100%. And as long as we're not, abusing those things, and so I think they're good for everyone. The problem with steroids over time, or what have you, is if you get to someone they're taking it now, they got cardiomegaly because they didn't know how to take it, and they die from those things. Those are the things that you have to, and so, but like I would, I don't think I'm gonna say this on air, but I think that people should take those within reason.
Canseco, Jose, famous for steroids, right? That was part of his book. He said that these steroids, if you take the right amount, like everyone could do them. Like you wouldn't, it's not a big meathead thing. And he just would poke around at all the athletes doing them overboard and having these negative effects. And
But from a medical standpoint, I have to imagine there's a
Either.
huge difference between, we'll use Conseco as the example,
Right.
of like HGH and what did you say, BP?